Hey guys, today I'm going to show you what I do whenever strengthening and stretching exercises do not help my shoulder pain. I'm going to use a 𝗗𝗟𝗚𝗖𝗟𝗔𝗜𝗠 tool, also known as a muscle scraper, instrument-assisted soft tissue mobilization. There's a bunch of different names for it, but I'm going to demonstrate for you how I use one of these tools on my shoulder to help loosen it up and get rid of that pain that I'm having in a specific area. So let's let the demonstration begin. This demonstration of the shoulder using 𝗗𝗟𝗚𝗖𝗟𝗔𝗜𝗠, what I'm going to do is I'm going to focus on the anterior deltoid, the middle deltoid, and try and hit the posterior deltoid. All of these fibers of the shoulder basically start at the top here and they kind of make an arc, just like that. They come down and insert. So that's the main direction that I'm going to go, is kind of in those arc, linear arc patterns straight down. So here we go. I got my sickle-shaped tool, and I'm just going to start in the front. Nice, easy direction, starting off light, checking the area out. I consider this process at first, you're scanning the area, and you're truly looking for what might be sore or tender. Right up in here, not so bad, but there's a spot right there that I can feel it. It just feels more intense. So I'm going to work that area over. I got a clock back there just to see. I generally go off feel. When I find a spot that's tender, I will work it over until it's pretty much does not hurt anymore. Or at least it's dissipated or decreased in pain by, say, 70 to 80%. Timing wise, a couple 3 minutes. So just even already going over that spot right there on the anterior deltoid, it doesn't hurt near as bad. And that was maybe a minute. So then I'm simply going to move to the middle deltoid. Up, all the way down. It's actually kind of hard not to look at it while you do it. Normally I will do this in front of a mirror so I can see what I'm doing. The top part of that middle deltoid, maybe a smidge, but actually right there at the bottom, I feel more tenderness. That's right there at the deltoid tuberosity on the humerus. Obviously, every time you use your shoulders, that deltoid is tugging on that area. So it gets inflamed, irritated. Let's get some blood flow in there. This is a very common spot that I find on my shoulder folks, and obviously on myself. Same thing there, same process. Started off light, scanning it, found that it was tender. Gradually work deeper. I'm gonna work that area over until most of that discomfort has dissipated. And I'd say it's about there, and now pretty much gone. Almost feels like just like a pressure from the tool. So now I'm gonna try to hit the posterior deltoid. Goes right along through there, wraps around. Sometimes going from underneath, this is kind of an awkward one to get that area. I'm holding my right hand, or my right elbow, to brace. So that way I'm not having to purely hold this arm up. You can go over top, whatever's easiest. It'd be best if you had a buddy who'd come in there and do this for you. The posterior deltoid is very common for folks, because also you have back here the rotator cuff muscles, especially that infraspinatus that comes around, the teres minor, teres major, they all cross right back up in here, plus the long head of the triceps going all the way up through here. This is an intersection. Just like in traffic, intersections more commonly have accidents. It's a busy area, lots of accidents can happen. I'm not really feeling a whole lot in that posterior deltoid. So the next spot that I'm going to check is just what I talked about. Right back in here, kind of the most posterior portion of my armpit. This actually has an anatomical name, this area, called your quadrangular space. That's another common one. The easiest way to get to that is take your hand over your head, like you're doing a tricep stretch, like such, and then just take the tool and get the most posterior portion of your armpit. You're gonna get all sorts of good stuff in here. Part of the tricep, part of the rotator cuff muscles, part of the lat, and even part of the deltoid. I'm really feeling it a little lower. So deltoid here, right there. I'm not sure, it's hard for me to tell exactly what that is, but it hurts. So I'm gonna focus on that area. So now doing that, most of the pain or discomfort from that area has dissipated, so I can move on. I'm gonna go back through, kind of check some stuff out. Overall feeling pretty good, nice and loose. Now I'll do a demonstration on my right side. It's going to be the same process, same procedure. We got the anterior deltoid, middle deltoid, and then posterior deltoid. The thing I like about this sickle-shaped scraping tool is that obviously I'm right-handed. This fits nicely in my left hand because I don't have as much control with my left hand. It's a little bit awkward, but the size of this tool helps me grab it and use it. And so right now, I'm going from close to far, or they call it proximal to distal, checking that deltoid out. In the front, the anterior deltoid on my right is a lot more sore than the anterior deltoid on my left. Sometimes when tissues get really bound up, you can feel and hear the crunch, but a lot of times as you work them, you'll feel that crunch smooth out. I would definitely describe this side as a good hurt, like it needed it. And I'm even starting to get in some 𝗘𝗘𝗏𝗧 right there in that anterior deltoid. 𝗘𝗘𝗏, fancy name for a hickey. Anybody who's ever had cupping, like, oh, you got some 𝗘𝗘𝗏 marks. Well, they're hickeys. This is a hickey. It'll go away. Yeah, so you guys can see a little closer. 𝗘𝗘𝗏, the redness. It's beautiful. Battle wounds. Get some blood in there. All right, so that anterior deltoid feels pretty good now. I'm gonna move on to the middle. And again, these fibers run from here down to the deltoid tuberosity. So that's the direction I'm gonna go. I go proximal to distal because it's easier for me. I could go from distal to proximal. It does not matter. You can even go back and forth directions. So this middle deltoid here, not really feeling a whole lot. Maybe a little bit down there at that deltoid tuberosity, but nothing like it did on the left side. Yeah, nothing major there, so I'm not gonna spend a whole lot of time there. The reason I love these tools and this technique is because it's so dang efficient. So now I'm working on the posterior deltoid. Again, this is kind of a hard area to get to. Be better if you had a friend, a buddy, a spouse, a cat or a dog. But on the posterior, I feel it right back in there, more so than I did on the left. So I'm gonna work that over, gradually pressing harder and harder as tolerated. And then I'd say most of that has dissipated. Also, my left hand's getting tired. Because if I needed to, I could just take a break, give that arm a break. It does not have to be one continuous scraping session. I can take a break for a few minutes and go back at it. That is perfectly fine. Very good. Shit. So then the next one, just like I did on the left, hand over head, I'm gonna do the right, hand over head, and I'm gonna check out the most posterior portion of my armpit. About to sneeze. So again, tricep, part of lats, posterior deltoid, and then some of those rotator cuff muscles, infraspinatus, teres major, teres minor. Teres major is not part of the rotator cuff muscles, but it's there. Comes up, attaches, we're hitting all that. I honestly don't care what muscle I'm hitting. I'm going off of feel. When I use this and I scan with the tool, where does it hurt? And where it hurts is where I'm going to use the tool. No different than if you have a lacrosse ball and you're trying to get that knot out of your back, you put that ball where it hurts. Same thing with the hip. You're foam rolling, you got a lacrosse ball, you put that lacrosse ball or foam roll where it hurts, and then you work that over. Same idea, except for this is just better. Longer lasting, more blood flow. So going back through there, I felt quite a bit of discomfort right through there. It's gonna be kind of that lateral border of that scapula and that armpit. That was quite sore. I know I'm tough, didn't show it in my face, but now it doesn't hurt. It's way less. It almost just feels like a pressure now. So now I know I can be done. And then there's the demonstration of the left shoulder and right shoulder. So the big takeaways from this are find an area that hurts and scrape it. So simple. If you're not sure which direction to go for a particular muscle, get on Google, look it up, deltoid. Very obvious right here. Everybody's got one. Muscle fibers go from up top to down. Follow the direction of those fibers. Same thing on this side. Deltoid, right here. Fibers go from top to bottom. Go that direction. Just now checking my general range of motion here. Much better, much more free. It feels like my shoulders can breathe. Skin feels a little irritated, but I also used a tool on it. It's going to. But as far as the muscle and the joint motion feels, it feels much more smooth, much more free, much more happy. I like happy muscles. So there you guys go. There's the demonstration of it. If you've tried everything else, whether it's the stretching, strengthening, yoga, any of those things, and you're still having some tightness or pain in your shoulders, this would be a great option. This is where I went to because I was not getting the relief that I needed from just general stretching. It helps some, but this helps a ton more.